The following program is a Town of Colonie television production of the William K. Sanford Town Library.
Welcome to Albany County News. I'm Mary Rozak, the Director of Communications for Albany County. In the next 30 minutes or so, we're going to talk about something that I certainly think you'll find very interesting, something you'll find that you may be prepared for or you may not. And the important thing is that we're here to tell you how you can be ready for the next disaster, how you can be ready and prepared. Joining me today are a couple of ladies that share a last name, so we'll talk about that in just a moment. We have Sue Riedy, the Senior Public Health Planner for the Albany County Health Department, and we have Public Health Planner Maureen Casale-Reidy. Now, okay, so sisters-in-law?
No relation.
No relation. We're actually, the I and the E are different in each last name.
Yeah.
Really?
Slightly different spelling. Just a
Can
coincidence.
knock me over with a feather.
Yeah. We always laugh that I'm the real Mrs. Reedy.
Oh, that is so funny. Okay, well now that's the new thing that I learned today. You're supposed to learn that one new thing every day, right? Well, so now that I know you're not related, but you get along very well.
Yes.
Let's talk about what's a public health planner or a senior public health planner do? What does that mean?
Well, I think at the public health level, our job really is to plan for and have the ability to respond to large-scale public health emergencies, and that can span from anything from, an anthrax attack to Zika to Ebola, even to flooding, where we're opening up shelters.
Mm-hmm.
So,
well, this is particularly an important time to talk about it because September is Preparedness Month. So when we are talking about different things, let's talk. I mean, Zika's in the news. It's been the summer of Zika, right? That's all we seem to be hearing about, and everything is changing from day to day. From a public health standpoint, and as a public health planner, and I'll let either one of you address this. How do you plan for the summer of Zika?
well, I think for us, the local health departments throughout New York State, we do receive guidance from the New York State Department of Guidance, and this year we were tasked with putting together a county plan. And depending on whether you were a county that was expected to have, one of the two identified mosquitoes that could spread the disease, determined what your planning requirements were. So in Albany County, we are very fortunate that there is no expectation that, the albopictus mosquito is here. It's not. We have no concerns. So we were very fortunate that our plans were really focused on how epidemiology would screen individuals who had concerns and who potentially had a travel history, going through that process, how we would communicate with Albany County residents about putting information out there if we should, so we have a plan for that. And also working with our community partners to really push out any messaging that we might need to push out quickly. But we are very fortunate that we are not at that stage, and we don't expect to be at that stage.
And I know, just being in New York, hearing the governor's plans for different parts of the state, making larvicide available for standing water and for folks to be able to get that. I mean, we hear about these things, and I'm sure that when area residents hear about it, they must think, okay, all right, it's me too. So I would imagine that, and I don't know if you're on the front lines with this, but I would imagine that there might be a fair number of calls that come in when things like that happen, when news like that happens, or the health department, I'm sure, would be contacted. Sure,
we do receive a fair number of phone calls. From what I've been hearing, that it's really focused on people who are showing, potential symptoms, and those symptoms are so broad that they really could be a multitude of different diagnoses at this point. But I think our job, really, when we pick up that phone, is to provide education to the residents, so that we are ensuring that we are giving them correct information, that we too are getting correct information from them, so that we can get them through any kind of screening process and get them any resources that would assist them.
So we jumped in and started talking about Zika, but when it comes to public health planning, there really is a matrix, a bunch of different things that you want to make sure people are prepared for. Let's talk about, there's all hazards planning. What does that mean?
Well, I think when you work in the world of emergency preparedness and response, there are so many different scenarios that you can try and prepare for. And the current trend is what we call all hazards planning, where you have one specific plan, which in Albany County is our emergency operations plan. That is our guidance on what to do in just about any emergency. It really talks about the management of a response plan, who your partners are, what the activation triggers are. But then within that plan, there's also different responses that we would take a look at. So for instance, in an anthrax attack, we know that we would be working with our hospitals, with primary care physicians to take in data from them. We would be working with our local law enforcement. And if it required, if the response was so large, we had to dispense medications such as Doxy or Cipro in that specific scenario, we would be opening points of dispensing sites. So those are basically large clinics where we have identified across the county that we would open very quickly. Our plans require us to have those open within 48 hours and to get medication into every county resident, which is 305,000 at this time, within 48 hours. So we have plans that direct us on how to do that.
And you'd have to have plans, right? Because that's a quick turnaround. So let's talk about the points of dispensing. Now, you've identified these places. How would, let's say, I would like to know where, ahead of time, where I might go and not want to wait. And I'm sure most people are going to wait until the last possible moment, but you're a planner. They're planners. Is there a way that I can find out? Is there something on the website that indicates where these points of dispensing sites would be?
At this time, we do not advertise that. What we would do is wait until we go back to that data that we are collecting, trying to determine the number of people that may be affected with the emerging infectious disease. And depending on those numbers, that's how we're going to determine the number of pods that we open and how many people we may be providing medications to. So again, when you talk about emergencies, there are so many different activation levels, and that's what we look at. And so we don't advertise that because we don't want to put out there that there's an expectation that 5 points of dispensing sites will be open at a particular time, because we might not need all 5 or 6. We may just need one in one particular area.
I see. Okay, so I understand. So that the short answer is no. You don't find out in advance because you don't know what this
exactly.
You have them identified, but it will depend on the situation. So let's talk about when we're talking about these sites, they have to be manned. Who mans them? How does that work when we're talking about distributing medications, distributing whatever needs to be distributed?
Well, I think Maureen and I, this is where we work very collaboratively. So we would work with Albany County Department of Health staff. We would work with Medical Reserve Corps volunteers. We have also had conversations with the County Executive's Office about training all Albany County employees to assist as well. And then Maureen also does an immense amount of work with community partners and getting them trained so that if the numbers are large enough and we need additional staffing assistance, that we can reach out to them.
Okay, so let's talk about some of the partnerships.
Definitely. The Medical Reserve Corps, which is one thing Sue mentioned, I know you're familiar with it as well. The Medical Reserve Corps is a group of volunteers in Albany County. They're both medical and non-medical. You don't have to have a clinical background to be a member, which is a little misleading with the name, I know, but those volunteers are registered and they're ready to respond in the event of an emergency in which we need to open all of these pods because, as you said, you need a lot of staff for each one of these pod sites, and that's really where we would would tap into the support of the Medical Reserve Corps.
Now, if I'm tapping from memory, but we're talking hundreds of people. Is it somewhere, I think it was like 500 or something at one point?
We have about 540 right now. Again, that's medical and non-medical. We have a variety of professionals. We've got doctors, nurses, RNs and LPNs, nurse practitioners. We've got pharmacists, EMTs. I'm sure I'm leaving a few out, but we have a range of clinical professionals. And we also have a wealth of community members without a clinical background who just want to be involved, want to help their community, want to be a part of preparedness. So we depend on them heavily.
So what do you have to do to become part if someone is interested? What do you do to sign up? What's the commitment level? Because I'm sure there must be some type of training you have to go through.
Yes, definitely. We do have some recommended trainings that we like everyone to complete. The initial process to sign up to be an MRC volunteer, it is web-based. We have a website, it's called Serve New York. It's actually a part of the New York State volunteer management system. So there's a couple ways people could find that website. First, of course, being albanycounty.com. If you go to the health department's page, we have a link to the Medical Reserve Corps and Serve New York. And then we also have a website, which we'll talk a little bit more about in a few minutes, I think, called registeredandready.com, www.registeredandready.com, which also links to the MRC. And again, MRC is just Medical Reserve Corps. So it's web-based to sign up for it. And then as far as trainings, we offer trainings on a regular basis of a variety of topics, obviously things like CPR. This past year we did psychological first aid. We've got a training coming up for weapons of mass destruction awareness. And then there's some...
I want you to talk a little bit more about some of these because really, seriously, so first of all, the psychological...
Yes, which that is something we actually had a partner from SUNY New Paltz, someone who is an expert in the field of psychological first aid, which is basically about during or after a disaster, knowing how to kind of respond to the needs of somebody. Obviously, a disaster is a traumatizing situation. There's a range of emotions and a range of ways people respond to what just happened to them. So it basically goes through some steps and kind of gives you a toolkit on how to work with people in that kind of scenario.
Okay. Weapons of mass destruction.
That is something that our partners at the Albany County Sheriff's Office are actually going to provide for us. So I am not an expert in that field, but it's always a good one. It gets a lot of people signed up for it because it's always an interesting topic to learn about those types of agents.
Right. It tends to focus on biological agents, chemical agents. They show a lot of fun pictures, so the audience is always very captivated. It's a very, very interesting training, and I think. So
the training would be to so that people can identify or know or what some of the things are that they may be. Okay.
Yes.
All right. Just trying to understand that a little bit.
Right.
CPR. Obviously, we know what CPR is. So if someone is coming in for the CPR training, then they become they're certified.
Yes, exactly. And if you're a registered MRC volunteer, that's something that we can provide free of cost to you as well for our registered volunteers.
Wow, that's a huge benefit. I think right from the beginning. So on average, are there a certain number of people that sign up? I mean, if you have 500 plus people that are in the MRC, they must CPR every so often. You have to be recertified.
Right, every 2 years. Yeah, it varies depending on the training, and again, depending on maybe how long that person has been a volunteer. Or sometimes they've been through trainings before and they want a refresher. And obviously, everybody has different responsibilities as far as work and life commitments. So with the MRC, again, we have those recommended trainings. You're always welcome to attend trainings. However, it's okay if you go a little while without coming to a training, and keep in touch with me via email, over the phone, things like that, so I know you're still out there, but maybe you don't have the time right now in your professional or personal life to come every month to something, but you're still interested in. Again, if something were to happen, if a disaster, if an emergency, we know that people will be there. They're in our system. They're ready to respond should something arise.
So how does that work? Let's say we're just going to stay on this line of thinking for a moment. There is an emergency, there is a disaster, and we want to activate some members of the MRC. Is it a phone call? Is it a text? Is it how are they alerted?
We right now we actually do have a phone notification system that we use. We also could could use email, but primarily we probably do phone as our first method. And we even do every quarter, so every 3 months, we do a phone notification drill, which is an automated drill that volunteers get. They have to respond saying, if this were a true emergency, would they be able to respond, and how long would it take them to arrive at the Department of Health? So they literally enter in their phone, 30 minutes or 45 minutes, however far away they are, and we do that every 3 months. So they're used to getting those calls, because if something was to happen, it's the same system that we would use to notify them.
Okay. This may sound very selfish, but I think I tend to look at the realistic point of this. Let's say a disaster happened, and very personally, the first thing you think about probably is your family, your own a very personal reaction to it. When it's something that is volunteer-based like this, I take my hats off to the volunteers. How do you know that we are going to be prepared? How do you know that you're going to get? Is there like some tracking mechanism or history elsewhere where they've had people respond like this that are volunteers?
Mm-hmm. Well, I believe there are percentages out there as far as how many volunteers you can expect to get during an emergency. And yes, so there's always going to be a certain percentage that aren't going to be able to. Maybe they're even out of town at the time.
Sure.
You never know.
Yep.
But that's why we are always trying to increase our reserve of volunteers. Again, we have over 500 in our bank. Mm-hmm. But with all the things you just mentioned, we can't guarantee that 500 are going to show up at the door. So we're just always trying to recruit new volunteers, get them trained, get to know them, get familiar with them, and have our reserve keep growing.
So register. No, go ahead, Sue.
Well, I would also add to that. Mm-hmm. We also work very heavily with our community partners, because one of the things that we learned during our H1N1 pandemic is that it's always useful to have individuals trained in those communities where we know that there's a trusted agent. So we've done a lot of work through the Citizen Corps to identify those partners who have very solid relationships within their communities or with their clients to assist us with that. Mm-hmm. So we continue to work on getting them trained in advance, so that if we only get 30% participation from the MRC volunteers, we know that we can tap into potentially the American Red Cross. We can tap into Catholic Charities and other organizations. Mm-hmm. So each year we continue to try and expand the numbers that are available to us, because I think it's what might be interesting for residents to know is that if we did open up every identified point of dispensing site, right now that's 6. We would need approximately 1,000 staff people to work at those 6 pods for 48 hours straight.
Okay.
So we have the numbers, but we're constantly trying to continue to increase those numbers, because we know that people respond in emergencies very differently. Again, if volunteers and staff are not prepared on their own and they don't have their family prepared, we know there's a good chance that they're not going to be able to assist.
Sure, and we're going to get to that personal family preparation in just a moment. But you talked about doing the phone notification as kind of like a test. Do you do drills of some sort? Maybe once a year, or maybe it's more frequent. I don't know.
We do multiple drills throughout the year on a variety of different scenarios. We are very fortunate to receive grant funding from the CDC, and as a requirement of that, we are required to perform large-scale points of dispensing drills. So every year we plan for that. We go and we look at that plan. We look and see if we've had to make any changes to it. We will train our staff and our volunteers of any of those changes, and then we go into that operational exercise where we really do go through the entire process. One of the things that we have done in the last 2 years is really tried to shorten the amount of time that individuals can expect to be in line to receive those medications, and it's become a very efficient process because of the number of exercises that we've done over the year. So perhaps 5 years ago we could get an individual in and out in about 12 minutes. And because of the changes that we've made from each point of dispensing exercise and what we've learned and how we've identified gaps and tried to improve that, our last point of dispensing exercise that occurred on June 2nd, we were able to get individuals in and out in less than 5 minutes.
Wow.
So that's a huge improvement.
That is a huge improvement.
Yes.
Wow. Well, congratulations
Thank
on
you.
that. No one wants to wait in line, especially in a disaster when you people are, I'm going to assume, naturally going to have a fear or a certain level of some panic. We are talking today with Sue Riedy and Maureen Casale-Reidy from the Albany County Department of Health. Let's talk about how people would be notified. If they need to know where these points of dispensing sites would be. What in a disaster situation is the plan? How do people get notified where they need to go?
Well, we've identified multiple communication platforms, and again, with any scenario, we understand that communication lines can go down. Maybe cell phones are not working. So we have access to. It's called the Access Notification System through the Sheriff's Office that we would utilize in the event. It has the capability to kind of bypass the current cell phone towers.
Okay.
And I'm not a technical person,
Sure,
so I don't want to
sure.
go in depth because I'm clearly not going to show, that I don't know. But we do have the ability. For us, what we've really tried to do in the last 5 years is to, again, it goes back to that partnership within the community and being able to work with them to get that messaging out on our behalf as well. So if there was, if there was a flooding scenario, we know that the Sheriff's Office, if they will push out a notification drill to the county residents, and then if need be, deputies will go out and assist in going door to door and knocking door to door and asking people, potentially to evacuate their home and, to go to identified shelters. So we have a myriad of ways, but there always is the concern that, if the power lines are down and people can't access their phones, there will definitely be an issue. And there is grant funding out there that the county does utilize so that we have additional communication platforms to be able to speak from law enforcement agency to law enforcement agency, and then to really work our way down to the public to get them the information that they need.
Okay, let's talk about being ready. We mentioned that, if responders themselves, volunteers, may not have their families ready, then they may not be able to respond. How, as a family, can you be ready for a disaster? And I'm going to jump in and as I ask you this, say, one of the best things that I have is something that you guys put out. It's in my office, and it's a calendar. And it's a calendar that talks about preparedness. And right on it, as I looked, there are a couple of days throughout the month where it says, buy an extra pair of shoes, buy an extra pair of pants, but has things that I should have ready. Let's talk about that, how we can be ready.
Definitely. That, we do a lot of work, outreach and education in promoting personal preparedness, which is basically just what you mentioned. It's about making a plan for what you're going to do during an emergency, a plan between you and your family members, getting a kit of supplies, which the items on the calendar, that's all about making your kit and then keeping your kit up to date and adding items to it, taking items out if they've expired, things like that.
So you're not buying everything all at once and feeling that hit. That's, I guess, what I think is the best way to
That's the idea, because it seems really overwhelming at first.
Sure.
You're like, oh, I have to have this entire kit for my entire family for 3 days, but you can buy a little bit every week. Or another good idea is if you go to a bulk store, if you go to Sam's Club and buy things in bulk, well, you can you've got a good value right there, and you can even split it with a family member. Maybe if you've got a sibling who's also trying to make their emergency kit, you guys could go in together on some of those bigger items and then split them. Canned food, stuff like that.
And one of the things you said that I want to make sure didn't get lost there is you said 3 days. You should have provisions for a minimum of 3 days.
Yes, I think minimum of 72 hours, 3 days. Depending on where you look, there's research out there that says you should also be prepared for up to 7 days, so 3 to 7 days. Because, and the reason that we promote that and the fact that it's promoted all over the country is because in an emergency, people tend to think that, we have all these great emergency response people in the community out there working, and that they'll be able to save you or come to your aid. But if something really bad is truly to happen, if there's going to be a true natural disaster or large-scale emergency, they're going to be focused in other areas and doing a lot of other work in the community. They're not going to be able to come and bring everybody water to their house. So if you've got those essentials that you need, like water, food, canned food, a can opener for your canned food, all that stuff, you're really taking ownership of being prepared yourself and for your family, and it takes the burden off of the officials who are trying to get everything else done in our community.
And I think we forget that, you put this kit together, and yet there are dates, expiration dates on that. The water, I'm sorry, but the water I don't worry so much about, but the expiration dates on that canned food. And so that's why I think the calendar really is a great thing to have, because it reminds you to go and check and replace what's in that kit.
Another good thing that I've heard many times, I'm sure Sue has too, is to check your supplies when you're setting your clocks back. Or
okay,
forward,
so twice a year.
Yeah,
okay.
Yeah.
All right. Where should you have your kit? Is there any recommended place where you could,
Well,
really?
It varies. Some people keep them, you just have a big plastic bin. If you're fortunate enough to have space to store that, a big bin. We've heard of, backpacks, duffel bags. I think someone even had like a big rolling garbage can type thing that they had in their garage that was all sealed up. So it really kind of varies depending on what your living situation is and what kind of space you have. Obviously, you want it to be somewhere where it's not going to get wet or not going to get contaminated or infested anyhow.
Sure. So you have food in there, you have extra clothing in there. When it comes to medications, what do you do with that? Because that's got to be, is there a special something that you keep somewhere else with medications perhaps to be ready?
As far as medications, we do recommend that you try to keep a supply of your maintenance medications that you might need during a disaster, as well as some over-the-counter type things that you might not think about, ibuprofen, Neosporin, things of that nature, first aid type materials. A first aid kit itself is a good thing to have.
Sure. One thing that we probably don't think about a lot, I know that the time is going. We thought, oh my gosh, we're going to have all this time to talk, and now it's almost over. Nobody thinks about a radio and batteries anymore, and I'm guessing that should be high on the list.
Very high on the list. I think let's go back to medications. I would just quickly say that if there are individuals who are interested in preparing for those medication needs that they might have, talk with your doctor. Perhaps they can give you samples. If you explain to them, why you are trying to, put together that kit, they may be able to provide you. But again, you'd have to look and monitor the expiration date on that.
Samples is a really good idea. I would think that would work well, because then you would have that short amount of time. In the short amount of time we have left, very quickly, if folks want to know more about, of course, September being the focus of being prepared, but every day people can go to our website.
Yes, we do have a website. I mentioned it once briefly, but we have www.registeredandready.com, where there is information about getting prepared, making a plan, getting a kit. There's also where you can find information if you are interested in joining our volunteer group, the Medical Reserve Corps, or other volunteer groups in the area. And we do also have some resources that we provide free to Albany County residents, some printed resources about getting prepared.
Which we can talk about.
Yeah, definitely.
Which we will show, but you can talk about what those are.
One item that we have called Preparing for Emergencies, Terrorism, and Disasters. It's a wonderful booklet, and you can go to that website, registeredandready.com, and request a copy of it along with some additional pamphlets and information. But it really goes into detail about types of disasters, types of natural disasters, and other emergencies. It gives you a sample list of supplies you could buy for your home, and just really outlines how to make a plan, how to sit down with your family, and also some things you might not think about, like do you have a family member that you take care of? Well, you should keep them in mind as well and make them part of your plan. If something happens in our community and you can't get back home, how will you all reach each other? Where will you meet to designate a meeting spot that's not your home? If something was to happen.
All great things, and I know that people can find links to that on.
Yes. Yes,
the
you go to
website.
that website, you can request a free preparedness kit is what we
Okay.
call it, and it's actually a little bundle of all educational booklets that you can request.
Perfect. Time, the bell is ringing. Thank you very much, Sue Riedy and
you.
Maureen Casale-Reidy. Not related. Now I know different spelling at the end from the Albany County Health Department.
Thank you.
I'm Mary Rozak. This has been Albany County News. I hope to see you again soon.